Are boxers prone to certain blood disorders? Boxing, a combat sport that has captured the attention of millions around the world, is known for its intense physicality and demanding training regimen. Boxers train relentlessly to develop their skills and endurance, but this level of physical exertion can potentially have negative effects on their overall health. One area of concern is the potential for boxers to be prone to certain blood disorders. Blood disorders refer to conditions that affect the components of blood, such as red blood cells, white blood cells, and platelets. These disorders can range from relatively mild to potentially life-threatening, and they can have a significant impact on an individual's overall well-being. While studies specifically focused on boxers and blood disorders are limited, there are several factors that suggest a potential link between the two. One factor that contributes to the concern of boxers being prone to blood disorders is the nature of the sport itself. Boxing involves repeated blows to the head and body, which can often result in physical trauma and injury. Head injuries, in particular, can lead to the disruption of blood flow and subsequent clotting issues. This is concerning as clotting disorders, such as hemophilia or thrombophilia, can have serious consequences for boxers. Furthermore, the rigorous training routines followed by boxers can also impact their blood health. Intense physical activity, such as high-intensity interval training and weightlifting, can lead to muscle breakdown and the release of myoglobin into the bloodstream. Myoglobin is a protein found in muscles that carries oxygen. In excessive amounts, however, it can be harmful and lead to rhabdomyolysis, a condition that can cause kidney damage and potentially lead to blood disorders. Additionally, many boxers engage in drastic weight-cutting practices in order to compete in lower weight classes. This often involves severe fluid restriction and dehydration, which can negatively affect blood volume and composition. Dehydration can lead to thickening of the blood, making it harder for the heart to pump and increasing the risk of blood clots. Even temporary changes in blood composition can have long-term consequences for a boxer's health. While there is a lack of comprehensive research specifically studying the prevalence of blood disorders in boxers, existing studies have shown some concerning findings. For example, a study published in the British Journal of Sports Medicine found that combat sports athletes, including boxers, had an increased risk of blood clot formation compared to non-combat athletes. This suggests a potential association between the sport and blood disorder development. As with any physically demanding sport, prevention and early detection are crucial. Boxers should have regular checkups and comprehensive blood tests to monitor their overall blood health. This can help identify any underlying issues and allow for timely intervention. Additionally, implementing safety measures during training and competitions, such as proper protective gear, adherence to weight management guidelines, and sports medicine support, can mitigate the risks associated with blood disorders. In conclusion, while more research is needed to fully understand the extent of the relationship between boxing and blood disorders, there are several factors that suggest a potential link. The physical nature of the sport, coupled with intense training and weight-cutting practices, can increase the risk of blood disorders in boxers. It is essential for boxers and their support teams to prioritize regular checkups and comprehensive blood tests to detect and manage any potential issues. By doing so, boxers can continue to pursue their passion while maintaining their overall health and well-being.